Good morning again. My name is Rob Hradsky. I'm Assistant Vice President of Campus Life and Dean of Students here at American University, and we were absolutely delighted to welcome you here this morning. At American University, we have been working over the years to support our students with disabilities, and I think as you look at some of the guides that are out there for prospective students, you will see that AU has been identified as one of those institutions, I think, that does a very nice job of supporting students with disabilities. In addition to that, we've been working hard for a number of years to try to really make sure that our programs to support students who might be affected by, who might be affected by interpersonal or sexual violence, have the kinds of supports that they need. And then in addition to that, have really worked very, very hard to educate our campus community about these issues. In particular, I wanted to share with you some of the work of our Sexual Assault Working Group. This is a task force that we launched, almost 10 years ago to help us start to look at the way that we were both preventing and responding to issues of interpersonal and sexual violence. We have a number of those individuals here in the room that I will ask just to raise their hand. These are members of our task force. And these individuals meet on a weekly basis to help us review our policies and procedures, look at our educational programs, help us look at the supports that we provide for survivors of interpersonal and sexual violence. They also work with us to assess our work and to communicate to the campus community about all that is happening on these issues here at American University. We've also been proud to be recognized this past fall by the Campus Prevention Council for excellence in prevention work around interpersonal and sexual violence. I do want to take just a moment to introduce a couple of folks who are here from American University, who may be folks that you would want to connect with while you're here to learn more about the work that we're doing. The first person is Marianne Huger-Thompson. Marianne is the Executive Director of our Academic Support and Access Center. That's the organization that works with our students with disability. And her colleague, who is Lindsay Northup-Moore, there she is. Lindsay is our Director of Disability Support Services. In addition, I wanted to introduce you to Regina Curran. Regina is our University Title IX Program Officer. So again, welcome to American University. We are happy to have you here with us this morning. And I'd like to now turn over the program to Anna Torres-Davis from the National Council on Disabilities.
Good morning. Thank you so much for coming out on this cold, cold morning. For the release of our report, Not on the Radar, Sexual Assault of Students with Disabilities. I want to thank American University and Dean Hradsky for sponsoring this panel. AU's task force is an example of how colleges can bring different offices on the campus together to address the issues of sexual assault as they pertain to all students, and in particular students with disabilities as well. For those of you that are not familiar with the National Council on Disability, NCD was established as an independent federal agency in 1984 with the primary purpose of advising Congress and the White House on disability policy. For 34 years, NCD has been a trusted advisor, promoting policies, practices, and programs that enhance equal opportunity for all people with disabilities and empower them to achieve economic self-sufficiency, independent living, and inclusion into all aspects of society. NCD drafted the first version of the Americans with Disabilities Act, which was introduced in the House and Senate in 1988. NCD consistently and thoughtfully weighs in on and makes recommendations for improvements on issues of national significance to persons with disabilities. In healthcare, education, employment, emergency management, transportation, and that's just a few. Anybody that wants to know more about NCD, please visit our website. We have an amazing amount of information on there on a variety of topics. NCD began to examine the problem of sexual assault of students with disabilities on campus in 2016 because of a growing body of information showing that students with disabilities were suffering a high rate of sexual assaults on college campuses across the nation. NCD was particularly interested in finding out if and how campuses were meeting the needs of students with disabilities, both before and after a sexual assault. Much work went into gathering the information for this report, understanding the current landscape on campuses across the country, and developing recommendations for Congress and federal agencies and colleges to help meet student needs. Today, we're very fortunate to have a panel of individuals with us to discuss this report and the intersection between sexual assault and disability, and the ways that campuses and the federal government can begin to address the weaknesses and the gaps that we found. So I'm going to start introducing our panelists. Wendy Harbour. Wendy Harbour is the director of the National Center for College Students with Disabilities, based at the Association on Higher Education and Disability, known as AHED. She is an Obama appointee to the National Council on Disability and a lecturer in policy and communication equity at St. Catherine University. She holds a bachelor's and a master's from the University of Minnesota and a master's degree and doctorate from Harvard University. She is active in the deaf and disability communities. I'm trying to get this mic right. Okay. I've been practicing Nitya's name for a month. Dr. Nitya Venkateswaran is a senior research associate with RTI International Center for Evaluation and the Study of Educational Equity and has a PhD in educational leadership and policy. She has 7 years of experience researching the implementation of educational initiatives and practices aimed to improve outcomes at all levels of education, from K-12 to post-secondary. Dr. Venkateswaran takes a social justice lens with her research and is committed to addressing structural inequalities that systematically marginalize groups. Nitya was the primary researcher on the report that we are discussing today. Dr. Sandra Martin, to my right, is a professor in the Department of Maternal and Child Health and Associate Dean for Research in the Gilling School of Global Public Health, the University of North Carolina in Chapel Hill. Dr. Martin's research focuses on sexual and physical violence. She most recently has been involved in studies to develop and implement campus climate surveys on sexual violence, including the American Association of Universities Campus Climate Survey on Sexual Assault and Sexual Misconduct, which we highlight in this report, and which found that 31.6% of students with disabilities reported sexual assault during their undergraduate years. Sandy's research also develops and implements and evaluates sexual assault prevention programs for various populations, identifies and responds to middle school and high school students at risk for trafficking, and better understand differential responses to sexual assault. Her research has been funded by multiple sources, including NIH, CDC, DoD, WHO, and state governments. She has authored more than 100 peer-reviewed manuscripts, as well as book chapters and reports, and her research has been cited in scientific manuscripts, government reports, and the lay press. Stephanie Ortoleva. Stephanie Ortoleva is the founding president and executive director of Women Enabled International, a nonprofit organization which works at the intersection of women's rights and disability rights, and educates and advocates internationally and regionally for the human rights of women and girls with disabilities through collaborations and organizations of disabled women worldwide. Among other issues, ending gender-based violence is a priority issue for WEI, and Stephanie has written extensively on various aspects of this issue here in the U.S. and internationally. Prior to founding WEI, Stephanie served as a senior attorney at the Department of Education's Office for Civil Rights and as an attorney and human rights officer at the U.S. Department of State, where she was awarded the prestigious Franklin Award in 2009 for her outstanding work on human rights matters. Annalise Brown has been working to address domestic and sexual violence for over 13 years. She is a senior program associate with the Vera Institute of Justice's Center on Victimization and Safety, which receives funding from the Department of Justice Office of Violence Against Women to provide technical assistance to colleges and campuses all across the United States and to community-based collaborations to help them improve services to victims of domestic and sexual violence who have disabilities or are deaf, and to support campuses in improving their response to students with disabilities and deaf students. She also oversees a group of national experts in crime victim and disability deaf services. So we're going to start today's panel with Nitya, who is going to provide an overview of the report and provide the key findings and recommendations. Nitya?
Thanks, Anna. Good morning, everyone. Thanks so much for coming. Want to again thanks Anna and also American University for sponsoring and help arranging this panel this morning. So I'll say my name one more time. My name is Nitya Venkateswaran, and again, as Anna mentioned, I'm from RTI International. I'm a senior research associate there, and a team of researchers at RTI, Talia Shalev, who's there in the back, as well as Jay Feldman, and Deborah Toll of VentionWorks collaborated with NCD to examine the issue of if and how campuses are serving students with disabilities. And today we're going to provide, as Anna mentioned, a brief overview of the report and some key findings. So sexual assault on college campuses has received increased attention in the last 20 years, and the federal government over the past 11 years has funded research examining and seeking to gauge the prevalence of sexual assault on college campuses to inform intervention strategies. But up until the most recent study under the Association of American Universities, as Anna mentioned, disability as a demographic was not included in federally funded research. And this study found that 31.6% of female undergraduates with disability are reporting non-consensual sexual contact, which includes sexual penetration and sexual touching. And this is at a higher rate than female undergraduates without a disability. So clearly, college policies and practices in the area of sexual assault should address students with disabilities. But not only did we find a limited focus on disabilities in the federally funded research studying prevalence of sexual assault, we also found a lack of research on college policies and practices that could inform what students could do to serve students with disabilities. And so our research aimed to fill this gap. We aim to explore what are gaps in current services? What challenges do colleges face in providing accessible services for students with disabilities? And what are, if any, promising practices that we could share? And in this report, we address the spectrum of campus policies and services by looking at prevention, post-assault, as well as adjudication. But we also narrowed our focus by looking mainly at how colleges serve students with either physical or sensory disabilities to serve as a jumping off point for further research. One of the main reasons we did this were these students have the longest history of service provision in higher education, and a significant portion of these students are often registered with the Campus Disability Services Office, and accommodations for students could be measured in pragmatic terms. Whether sign language interpreters are available, is the reading matter accessible to students, and are trainings available in physically accessible buildings. And so because of the exploratory nature of our research and our chosen scope, we want to emphasize that further research is needed, not only on either prevention or post-assault supports, but also looking at disabilities that we didn't include in our report. So to examine the questions and to examine these issues, we mainly talked with college staff at 27 college staff, either Title IX coordinators, ADA coordinators, or administrators of disabled student services programs on campuses from across public and private and two-year community colleges. We also talked with some experts in the field. These are either researchers or technical assistance providers in the area of sexual assault, disability, and our Title IX procedures. And to get some broader feedback, we administered open-ended questionnaires to the college staff that I mentioned, as well as students to get some broader feedback. And we use a sample of convenience when designing this study. We also framed and enhanced our findings with existing research and policy reviews. And this is to situate our findings in a broader context as well as triangulate some of our findings. And now I'm going to share a few findings. First, I want to suggest that what we found, which the title of our report makes really clear, is that not only students with disabilities have not been on the radar up until now of federal research, it's not on the radar of many college staff either, as this quote from one of our questionnaire respondents. This person wrote, sorry to admit that this subset of students has not really been a focus of sexual assault awareness, but is now on my radar. And throughout our data collection process, we continuously heard sentiments like the one above, which suggests that the admission at all levels is a systemic issue and not solely an issue of individual colleges facing challenges. And there's much to be done across the board to raise greater awareness and make supports accessible and inclusive to students with disabilities. And many of our participants also recognize that responsibility. So I'm going to highlight a few gaps that we heard. The report also details some promising practices, which we'll share a little bit later. So one area we examined was prevention education. Under the Clery Act, colleges are required to not only provide training and orientation for new students and employees, but also prevention education that's sustained and ongoing over time. And emerging research has shown that this education can be effective in changing attitudes around sexual assault. But and also actually effective in increasing awareness of reporting and student supports available on campus. But in order for education to be effective in creating changes in attitudes and behaviors, research suggests that prevention programs also need to include diverse student communities so that students feel that the content is relevant to them and aligned with their norms and values. So we asked these questions. Can students access the trainings and information? And do they address students with disabilities? And we found challenges in both areas. We heard first that most staff did agree that and suggest that the trainings themselves were accessible. But we heard that some work needs to be done to have compliance by all, and particularly the areas of the online education programs that campuses provide. 19% of the interviewees and 12% of the questionnaire respondents indicated that some or all of the online training was not accessible to students. And in particular, we heard one college staff member describe how they had to work with the online education provider to ensure that the program that was available to students was accessible to all. And others also mentioned some challenges with accommodations during in-person events, but we're confident that students could request the accommodations ahead of time if needed. But as this quote highlights from the student, one of the main gaps we found was the inclusiveness of prevention programs. And this student said, they don't talk about students in the context of sexual assault. So out of our questionnaire and interview respondents, only 3 colleges indicated that they included content related to students with disabilities in sexual assault prevention education. And this mirrors a national trend that we found from some emerging research that suggested only 10% of colleges out of a sample of 68 indicated that their prevention programs included and addressed students with disabilities, and this is from the EverFi group. So even though some progress may be made in terms of physical accessibility or in providing accessible accommodation supports and in-person trainings, there's more work to be done in the online education side. And how colleges respond after an incident of sexual assault is also critical. Therefore, we examined whether students with sensory or physical disabilities would have access to the supports when they needed it. And we found that students may not have immediate access, and that colleges might not ensure that disability-related supports were readily available. And this is mainly because colleges did not have policies in place on how students would be accommodated if they accessed trauma services. So 52% of our interviewees reported that they would be acting on the fly. They would figure out the process in the moment. If, for example, a student who is deaf or hard of hearing required an interpreter if they wanted to either report an incident of sexual assault or access some support services. And 9 college staff suggested that a wait time for an interpreter would be more than 24 hours if they were available at all. And because the staff acknowledged that they didn't have procedures in place, they would, if a student requested accommodations, that they would call the Disabled Students Program Services to secure those accommodations. But they acknowledged, what would happen if something happened at night or on the weekend, when often sexual assault incidents occur. And we also found that it wouldn't be clear to the student either what supports and accommodations would be available to them. And this is one suggestion made by a student about how their college could improve. Put information on what can be done for survivors. Share information on exactly what disability services can and would do for survivors on the website, for example. We looked at the colleges in our sample. We looked at the Title IX website, the Sexual Assault Resources website, as well as the Disability Student Services website to see what was mentioned about accommodating students with disabilities. And there was no mention on those websites about the process or receiving accommodation in crisis situations. And on most of the college websites, disability services was not mentioned as a resource for students on the Sexual Assault Resources webpage, where they often have many different student services listed. So again, making information available to students and to practitioners and college staff would be a first step. So I'm going to highlight now, we detail additional findings in our report, but as well as some gaps in services, but I'm going to give a brief overview on some of those findings, and then we'll go to some recommendations. So first, as we discussed at the beginning, that there's a lack of focus in federally funded research on including disabilities as a demographic in sexual assault studies. And then we touch upon the assault and prevention education programs that are not fully accessible to students, especially the online training. and that because of the lack of policies and procedures that outline accommodations for students, colleges have not ensured that disability-related supports are readily available. Some additional gaps that we detail in our report. That's first, that some websites and online forms are not screen reader accessible and do not adhere to the guidelines of web accessibility, and as well as printed materials not being accessible to students with visual impairments. And we also talked about the lack of awareness and understanding of support staff, of whether it's necessary to include students with disabilities in the prevention programs, as well as training for staff, not only understanding accommodations, but understanding how to support a student with a disability if they've experienced an incident of sexual assault. We also highlight that some of these gaps in services or lack of awareness could be the result of the lack of interaction between the Disabled Student Services programs and the Title IX office. Often we heard that they were siloed and there was a lack of communication between the two. And our report has an extensive list of recommendations to elevate students with disabilities as a critical demographic to be addressed in college sexual assault policies, research, and practice. Our key recommendations to colleges are to include students with disabilities as a demographic in campus climate surveys on sexual assault. And this is to increase the awareness of the prevalence of sexual assault for college staff members. Again, creating crisis policies and procedures on providing sexual assault services to students with sensory disabilities, especially deaf or hard of hearing students, so that they can receive services within 24 hours. And guaranteeing that campus respondents and support providers have access to emergency interpreter services or communication methods for students. And next, ensure that online and in-person prevention awareness activities are accessible to students with disabilities. Include information about disability accommodations on the Title IX webpage and related information. And create agreements with community-based providers with the expertise to support survivors with disabilities. And we know that there are services out there that campuses can leverage. We also have some few key recommendations to federal agencies. And to the Department of Justice, we suggest when funding research on sexual assault that they require researchers to include students with disability as a demographic. To the Department of Ed, we suggest that they should provide colleges with technical assistance, document or training on the rights of students with disabilities, to have the necessary accommodations of reporting assault, utilizing sexual assault support services, and in the institutional disciplinary process. This training should include information on various types of disability-related accommodations, including captioning services and sign language interpreters. For the Office of Civil Rights in the Department of Education, we suggest that they inform colleges they must provide the required Title IX information in accessible formats to students with disabilities, specifically information on their rights under Title IX, the contact information for the Title IX coordinator, and how to file a complaint alleging a violation of Title IX, and how to request disability-related accommodations. We also encourage them to encourage colleges to reach out to students with disabilities about sexual assault educational programs, available support services, and available disability-related accommodations available to access. Access them. We also provide some key recommendations to Congress. They should require colleges to collect the number of all reported sexual assaults on students with disabilities, not just when the assaults are hate crimes, and include this information in their annual security report. Require colleges to include a statement regarding disability-related accommodations that will be made available to students with disabilities during the reporting and disciplinary process, and how to request accommodations. And require memorandums of understanding between colleges and local law enforcement with protocols for communicating with students who are deaf. concludes my brief overview of the report. I want to kick it off to Anna.
Thank you. Thank you, Nitya. We're going to have time for questions after the panel, so as you think of them, please jot them down or keep them in mind, and we're gonna allow plenty of time for that. I'd like to start my first question with Sandy. Sandy, research for many years has documented the high prevalence of sexual assault against women with disabilities. And this includes research conducted during the last 10 years showing high rates of assaults on students with disabilities on college campuses. Your own research in community samples of women documented high rates of sexual violence against women with disabilities. In NCD's report, we point out that the 2014 White House Not Alone report on campus sexual assault, the first of its kind on this topic, included a campus climate survey on sexual assault. It encouraged colleges to use it as a template for their own campus climate surveys, but it didn't include students with disabilities as a demographic. We also point out that DOJ published a very recent large-scale campus climate validation study using the Not Alone template as a starting point. But that survey also didn't include students with disabilities as a demographic. In contrast, the American Association of Universities study, a non-federal study that you were involved with designing, included students with disabilities as a demographic and came up with a pretty startling finding. One concern we have is that colleges will use the Not Alone or the DOJ climate surveys as templates for their own campus climate surveys because they're widely recognized, and thus students with disabilities will continue to be left out. Can you please talk to us about what campus climate surveys are, why they're important, and why the AAU research team included students with disabilities? And leave a few minutes because I have another question for you after that one.
Okay, I will do my best. Thank you for that question. I bet you we have students in the room who've received surveys from their universities. Is that true? Okay, so they probably know what a campus climate survey is. It's basically a survey that's given to students and asks them about a lot of different topics related to sexual violence. The reason that these surveys are administered is because the administration who designs programs and policies related to sexual violence, they need this type of information to figure out what is going on campus, to identify the needs of their campus so they can develop policies and procedures and programs to respond to sexual violence and to try to prevent it. Now, there's a lot of campus climate surveys out there, as you mentioned, Anna. They all are a little bit different, but most of them, they ask questions about a few different topics. Safety on campus. Their students are asked if they feel safe. They ask about experiences of violence on campus, including sexual violence and sexual misconduct. And typically, in that sexual misconduct domain, they ask about stalking, they ask about sexual assault, they ask about sexual harassment. Also, the surveys want to know about students' knowledge about resources on campus and whether they know where to go to get help, and if they use that type of help if an event does occur. And finally, the surveys ask about characteristics of the students. And this could be gender, year of study, and in the case of the AAU survey, we asked about disabilities as well. I wish I had the kind of memory where I could tell you exactly who in our survey research team said, oh, we need a question about disabilities. I can't recall that. But I can tell you that we had more than 20 people and had input into the design of this survey. Not just researchers like me, there were some researchers who studied sexual violence, and we know about ties between sexual violence and disability in the community. But there were also the practitioners in the university who worked day to day with the students. And those are the people who really had the pulse of what was important day to day in the lives of students. And we also had input from students. And I do remember that everyone thought that this was really an important question to put in there. So I think it was this diversity of people and the number of people who had input into the survey design that really ended up having this question in the survey.
That's excellent. Thank you so much. What types of research studies might be next on this topic? And what further questions should be asked in further campus sexual assault research beyond, do you have a disability?
Well, researchers always like to ask a lot of questions. We always have a lot of questions. And in the AAU survey, whenever you design a survey, you don't want to overburden the survey participant. You can't make the survey too long or people will stop taking it. So what we did was I had one question about disability in that survey, and it was asking if the respondent was registered with the disability services at that university. But in the future, I'd love to see other questions as well. It would be good to know the type of disability, whether it was visual, hearing, emotional. Also, I think it would be really important to know the degree to which the disability impacts day-to-day functioning, because there has been some research in community literature that the greater impairment is related to a higher level of risk for victimization. And finally, I'd really like to know about when did the disability begin compared to when did the violence begin? Because in some cases, I believe, and I think there are suggestions, that the disability places people at increased risk for violence. In other cases, it could well be that the violence preceded and could have been actually one of the catalysts that resulted in the disability. So I think we need more research on all of those topics.
Wow, thank you so much. That's very interesting. Wendy, you're up.
I'm ready.
All right. Wendy, as director of the National Center for College Students with Disabilities, you and your staff receive technical assistance requests on a wide swath of issues regarding students with disabilities in higher education. Does the report match with the issues you've been getting from students, parents, and higher education professionals? And if so, can you tell us a bit about what you've noticed? And I also have another question for you, so save some time.
Okay, I'll try to be brief. Short answer is yes.
Next question.
It matches it. We're called the National Center for College Students with Disabilities, but that's just because we wanted to keep college students at the center of our work. Actually, we are the only center in the whole country that serves anybody in higher ed on anything related to disability. So we get calls and emails and Facebook messages and you name it from students, parents, faculty, higher ed administrators, policymakers, just a big group. So, of course, we've also fielded questions on the topic of sexual assault, about access to services. We've had security officers calling us and asking us for training materials, all of just a wide variety of topics. The title of this report gets to me every time, the idea of not being on the radar, because that very much matches up with what I see in terms of colleges just not necessarily thinking about students with disabilities beyond what the Disability Services Office is doing for classes. So the idea of, oh, hey, maybe this student wants to study abroad, or maybe they've experienced sexual assault, or maybe they're going to do an internship. Sometimes that's a leap for colleges to make. But it sort of has a double meaning for me, because I think that gap or that problem is also not on the radar of the students with disabilities and their parents. So when you go to college, you assume that if something's going to happen, the college is going to help you and they're going to be ready to deal with it. And so to find out it's not on their radar, it's a very, in the moment when you're in crisis is not the time to find out that your college doesn't know what they're doing or they haven't thought of this scenario before. So it's a very powerful thing, that phrase, not on the radar. But I also think Nitya offered us some hope in that once it's on your radar, then you want to act. So I think that's also been true of my experience in that often once parents or students or faculty or staff know about this or they start thinking about it, then they want to do something and make their campus better.
I know that you provide referrals to students with disabilities and other callers, but you do provide referrals to students that have experienced sexual assault. Please speak to us about the referrals you make and any of the challenges that you face in making those referrals.
Right, so we are not an advocacy group. Our main job is just information and referral, the technical assistance. So for instance, if a student calls me, I'm not necessarily going to be doing counseling. I'm going to help them find counseling resources on their campus or sometimes the community. So again, many campuses are just thinking about disability in terms of compliance and whatever the Disability Resource Office or Disability Resource Center is doing. And so I think when I refer people, often if they're in crisis, I stay on the phone with them and we look up the resource together, or I even stay on the phone with them while they walk over to where, or get over to where they're going. But I never know what they're going to find when they get there. And it's always really hard for me sitting in my office wondering, so we've found the, sexual violence center, and that's great, but I have no idea if they're going to be able to provide interpreters, or if the building's accessible to wheelchairs, or if they understand that the student arrived on campus with previous trauma from childhood. I think there's also this assumption that students are very well equipped with knowing their own disability, but a lot of students with disabilities don't even identify as having a disability. Oh, I just have ADHD, I just have depression, I'm just bipolar or diabetic or whatever it may be. And so, they may arrive in the office, but they don't know the terminology to use. They don't know to say, I have a disability. They don't understand that disclosure has to happen over and over and over and over through the entire process of being helped in order to get accommodations. So it's very difficult for me when I do referrals, because I know often these students are very alone and they don't really have an advocate or ally. And in fact, I often advise them to find one on campus. We'll look for disability studies professors, or, I'll have them try to identify someone in the Disability Resource Center that they can really talk to. But it can be very lonely to be a student with a disability in crisis on campus.
Thank you, Wendy. Last question. Given your work with a variety of people in higher ed, what do you see as next steps for campuses and professional organizations that want to improve their responsiveness on the issue of sexual assault and students with disabilities?
Well, first, Nitya wrote this lovely little report, so you can read this. So I do recommend that. It actually is a beautiful report. we just finished a research brief on addressing campus climate issues. So a lot of what Sandy was saying really resonated with me. We recommend 3 steps for campuses that want to work on disability issues, and that includes sexual assault. First of all, figure out what you're doing. And it sounds really simple, but use campus climate surveys. Just take a look at what's happening. Make sure your disability resources staff is well-funded and has enough staff. Make sure everybody's collaborating. Second, make sure there are lots of ways information is going out about disability. So don't just think about training the staff. Think about putting something in new student orientation. Think about faculty trainings. Think about new employees having to learn something about disability when they're trained. Get the information out there. And then the third thing is just disability is not something that should happen on Disability Awareness Day. And it's not something that should happen in the Disability Resource Center. It should be all over the place. So students should be talking about disability in class. There should be events on campus with speakers who have disabilities talking about disability. You're having a film fest. There are lots of films out there about disability. You're doing sexual assault trainings. Mention disability in those. Lots of ways to engage the whole campus on the issue. Also, any of you who are doing research on any topic related to sexual assault, please put people with disabilities in there. I just wanted to echo what Nia and Sandy said about that, because often when people call me, I have nothing to give them. I have no stats. I have no links to reports. I have nothing. So give me something to work with. And last is we have a DREAM student group at the NCCSD, and we try to help students connect and organize with each other. In fact, the DREAM coordinator is here. Kim, can you raise your hand? She's on your left side of the room. But if you're a student, think about organizing with other students who have disabilities, because you can create change if you're all working together, and you can find community and support and be allies for each other if you found each other.
Thank you, Wendy. My next questions are for Stephanie. Stephanie, sexual assault is a crime of violence. And like any crime of violence, perpetrators are likely to choose victims that they see as vulnerable. In that light, it's not surprising that women with disabilities experience such violence at higher rate than women without disabilities. You've studied and written extensively on the barriers faced by women with disabilities all over the world in accessing services and the justice system related to sexual violence and the severe impacts of this exclusion. In one of your publications, you say, and I quote, "Women with disabilities also face many accessibility-related barriers to justice and are frequently not provided with reasonable accommodations when reporting gender-based violence. These accessibility barriers may be physical, informational, or related to communications, but they all limit how women with disabilities can interact with the justice system. Beyond the physical barriers, and based on your substantial work in this area, what are the 3 main contributors to the fact that women with disabilities have been left out of conversations and planning about sexual assault prevention and face the difficulties in getting an adequate response to reports of assault?"
Thank you, Anna. Well, it's always scary to be quoted back to yourself, but, oh, yes, I did say that. I think I'm going to start by quickly relating something I heard on the news this morning. A very prominent senator was being interviewed about his strategies for advocacy and policy, and he mentioned women, he mentioned people of color, he mentioned LGBTI people, But what else? Who didn't he mention? And this is like a progressive senator. So that's, I think, the beginning of our problem. We all, of course, know that gender-based violence is not about sex, it's about power and control. But yet there are assumptions about people with disabilities, women especially, and I mostly talk about women because that's what my work has been, but their attitudes about women as not being sexual beings. So this sort of enters into how gender-based violence and Title IX people perceive disabled women when they come forth with these kinds of controls and complaints, rather. So another problem is, as we've said repeatedly, that we don't collect statistics on disability. But it's not only in terms of the climate surveys, but it's even in terms of other statistics about numbers of students with disabilities on college campuses. The other problem is, I think, that there hasn't been substantial training for Title IX people and about working with students with disabilities. I think lots of people forget the important fact that women with disabilities are women too, and very often we're not seen as women. And we've talked a lot about the sexual violence prevention videos and how they need to address people with disabilities. But it's not only that, they also need to include people with disabilities visually in these presentations so that you're seeing students with disabilities as part of the population where you're addressing sexual violence. And then just briefly about the justice system itself, I recall a couple of years ago, the Office on Violence Against Women and a couple of other federal agencies issued a guidance on gender-sensitive policing. Now, this was mainly focused on external law enforcement officials, but it's obviously applicable to the university law enforcement personnel as well. And it was wonderful guidance on gender-sensitive policing, but there was not a word about disabled women or disabled perpetrators and how those issues should be addressed. And also, I think another problem is that we were talking about disabled women and people not being seen as sexual beings. And I think that sometimes enters into the picture when a disabled woman comes to the Gender Violence Office, Prevention Office, and talks about how her partner assaulted her. And, I think sometimes these people are getting over the shock of the fact that this disabled woman actually had a partner. So I think all of these are some of the barriers that we need to work on quickly.
So
Because the violence isn't really slowing down,
Based on the answer that you just shared, can you give me some specific actions that colleges could take to change some possible attitudinal barriers that exist towards women with disabilities and that impede students from accessing services and justice? I mean, what role can students and staff with disabilities who attend and work at colleges play as well in these?
Well, I think any of the programs that exist need to be designed with the input of students with disabilities. And students with disabilities need to be an integral part of implementing those programs. So that's extremely important. Coordination, real coordination between a Title IX office and a Disability Services office. I mean, one of the things we were pointing out about from the study is that very often the Title IX or the gender-based violence services are available on the weekends, but the disability service isn't available on the weekends and evenings. That's just not acceptable. Students definitely need to demand this kind of inclusion, and one of the tenets of the UN Convention on the Rights of Persons with Disabilities is nothing about us without us. And I think that's something that really applies here. The other thing is that we've often talked about the Disability Services Office and professors in the Disability Studies program. But people with disabilities need to be all over the campus, not only teaching disability studies, but teaching history and physics and any international relations, law, all of these areas, so that students see themselves in positions of leadership and authority, but also that other students see disabled people as people with authority, not only in the areas of the disability work that so many of us do.
Thank you, Stephanie. Now I'm going to move on to Annalise. Last but not least, Annalise, who has done a lot of work on helping organizations understand how they can serve women with disabilities that have suffered sexual assault. Lise, the Vera Institute of Justice receives funding from the Department of Justice Office of Violence Against Women to provide training and technical assistance to OVW's campus grant program grantees and community-based organizations on enhancing their response to student survivors with disabilities and women survivors generally with disabilities. Can you share the support that the Vera Institute makes available to grantees of campuses that have received these grants to help them improve their response to sexual violence with students with disabilities?
Sure. Is this loud enough? Is everyone able to hear me? Okay, great, thank you. So as Anna was mentioning, at the Vera Institute of Justice, we receive funding from the Office on Violence Against Women, both to provide training and technical assistance to their disability grant program. So this is a grant program that gives funding to communities for community-based violence against women organizations or gender-based violence organizations and community-based disability organizations to come together to improve the community response to violence against people with disabilities. And that work we've been doing for over 10 years, and I personally have been working on that grant program for about 5 years. And then just recently, so within the last year, we also received funding through the campus, OPW's campus grant program to support grantees under that, so campuses to enhance their response to student survivors with disabilities. I will say that that definitely is a situation of building the plane while flying it. That grant program has been established for many years, and this is kind of the first time within this last year of trying to figure out, like, okay, so how do we fit students with disabilities into this work? So primarily the work that I've been doing so far has just been providing training to those grantees to raise awareness about student survivors with disabilities and some of their unique needs, some of the barriers that they face, and then how to overcome those barriers. And we are also available to provide training and technical assistance to those grantees. I will say we haven't been getting a lot of requests because, as this report says, it's not on the radar. So a big part of what we're trying to do is, again, through training right now, kind of put it on the radar for these campuses. I will also just make a plug that the solicitation is open right now for the campus grant program, and I personally would love for a campus to come in and apply for that and say that they are interested in specifically looking at or focusing on students with disabilities. Of course, any campus needs to make their services and supports available to students with disabilities. But so far, Gallaudet is the only campus that kind of has a program or is fully focused on students with disabilities or deaf students that has participated in the grant program. So it would be fantastic if campus came in specifically wanting to focus on students with disabilities and deaf student survivors.
So just to be clear to anybody who's not familiar with Department of Justice's work and Office of Violence Against Women's grant program, this is a program where they provide grant funding to colleges across the nation who apply for to do work around campus sexual assault. That's one of the campus grant programs, is the campus sexual assault one.
Well, it's the grant program itself actually focuses both on domestic and sexual violence or intimate partner violence. So most of the campuses, it's a dual focus.
Okay, and so, well, let me move on to the next question. As you know, NCD makes numerous recommendations in this report on ways that colleges can be responsive to students with disabilities prior to and after an assault. In your experience, if a college were to prioritize these, what are the top actions that they should start with? And take your time.
Thank you. So one of the things that we've heard that Nitya and others on the panel have touched on is just around providing accommodations to students with disabilities and deaf students, and particularly those are for our purposes, for survivors, that different sexual assault responders and support services need to be able to provide accommodations and meet those accommodation requests in a timely manner. And so we know that is not happening right now. In looking through the report, one campus had a 14-day wait on providing an accommodation. And when I think about, campuses have, there's a reason that there are hotlines that operate in the community and on campuses 24 hours a day, 7 days a week, because people need support in the moment. They may currently be at risk, and for those to not be available to students with disabilities or deaf students is just unacceptable to me. And I also, I just think about it is very hard for survivors to disclose the abuse that they've experienced. It takes a lot of courage to do that. And so I just think about a student with a disability or a deaf student who is, has decided that they want to come forward and then to be told that we can't help you right now. It's going to be a 2-day wait, it's going to be a 4-day wait before we can provide that accommodation. My guess is that that person is likely not going to go back and receive that report. They are hearing that as, we can't help you, we don't know how to help you. And there's been many mentions of, many of these other, offices or services will rely on disability services for help with providing those accommodations. But again, those offices are not open, again, 24/7. And so it's really important that each of those offices, whether, it's law enforcement, again, the 24-hour hotline, if that's something that you have on your campus, that they know how to provide those accommodations and are able to do that and don't have to wait for disability services to open on a Monday or open the next day. And so, we always recommend having, for each of those entities, to have relationships with interpreting agencies and to have agreements with local interpreting agencies if they're if they can, can they provide interpretation in the middle of the night if that's necessary? Can they come very quickly to provide that? And we also recommend, if possible, this certainly doesn't exist in every community, but trying to find interpreters who are trauma informed and have interpreted on the topic of sexual assault. We've just found that to be very important, that some interpreters may not feel comfortable interpreting, or just maybe using language that is, or terminology that is not kind of victim-centered or empowering. So something that's very important. I spoke with someone who works for Disability Services, or is the director at the University of Tennessee, and she talked about how she does work closely with, say, counseling services. So if somebody comes in and they need an ASL interpreter, they'll work really closely together to talk about, like, okay, so yes, this person has an interpreter that they are using or they work with in the classroom. They may not want to work with that same interpreter kind of moving through the student conduct process. So just kind of coming together and being really thoughtful about that. And that being said, also making sure that you're doing so in a way that maintains the confidentiality of the survivor. I feel like that's something that is oftentimes forgotten or ignored, unfortunately, where someone may just call someone from counseling services, hey, you will call Disability Services, we have so-and-so here, they've experienced a sexual assault and they need an interpreter, or they need an accommodation. And we just know that it is so critical for survivors, any survivor, including survivors with disabilities and deaf survivors, to really be able to maintain control over who knows their story, how their information is being shared. So that's just really critical. Anytime you're collaborating or working together with another entity, that you make sure you're doing so in a way that maintains that confidentiality.
I was wondering if does the Vera Institute offer technical assistance to non-DOJ colleges? Could colleges contact Vera Institute for training or technical assistance on how to accommodate students with disabilities in sexual assault?
Yes, absolutely. We have just the way that the funding streams are set up through different grant programs, kind of through our Office on Violence Against Women campus grant program. We are specifically just working with campus grantees, but we have other sources of funding that enables us to work with any campus, and we would be really happy to do that and just love to do that. Can I offer one more suggestion?
Absolutely,
Do I have
yes.
time?
Yes, you do have time.
So we have talked a lot about so one thing I will say, just adding, when I was mentioning collaboration, so many campuses, like American University, has a task force that focuses on sexual assault. In my experience with many of the campuses that I've worked with thus far, Disability Services or any disability entity, student groups, community-based organizations are rarely participants in that task force, again, because students with disabilities are not on the radar. When forming those task forces, don't necessarily think to include or invite disability services. So that is just so critical to have that voice at the table. If possible, have the voice of a student with a disability at the table. And then also, we've talked a lot about the importance of training, which is so critical. We talk often in the work that we do about professionals who may be very well versed in the work that they do, experiencing what we refer to as a crisis of confidence when somebody kind of walks through their door, somebody with a disability or a deaf person, and unfortunately may have a reaction that can feel to the person with a disability that they're an anomaly or a burden. And again, just thinking about, you've just experienced trauma, you are you've kind of decided it's time to come forward about this, or you want support, and just to be greeted with that reaction really will just serve as a barrier for someone, and also sends a message of like, I don't know how to support you, or I don't know how to work with you. So it's really important to, for anyone who's, any sexual assault first responders on campus, and support services, that they be trained on the increased risk of students with disabilities to experience sexual assault, that they have a foundational understanding of disability, and that they're also aware of the unique experiences of survivors with disabilities, including barriers to support and healing and justice. So from the report, what I could see for training that is being provided for campuses that actually do provide this training, it often focuses particularly on raising awareness of disability, which is fantastic. That's such an important part. But it's also really important for any support services to understand, again, some of the unique experiences and unique barriers that survivors with disabilities and deaf survivors may face. And one in particular that I just want to mention is mandatory reporting. That also may not be on the radar of support services within campuses. And again, this absolutely varies from state to state, kind of based on your state laws. But in some states, the laws are written in a way, mandatory reporting laws, that are just very, very broad and could include anyone with a disability who comes forward about the abuse that they've experienced. And mandatory reporting is just an example of when someone's story can just get completely out of their hands. So they share that they've experienced abuse, and if a report is made, it triggers, it can trigger this reaction where the survivor loses the ability to make decisions about what they think is going to best help with their healing and keep them safer, or keep them as safe as possible. And so that's just really important for anyone who's providing support services to be aware if they have any obligations under mandatory reporting, to be aware of what the implications of a mandatory report may be on someone's life, and then also therefore just informing anyone that they're working with that they are mandatory reporters, if that is the case. Again, some places will say, well, if I know I'm working with a person with a disability, then I will tell them I'm a mandatory reporter. But because we know that there are many hidden disabilities, and they may not know that the moment they meet someone, so just making sure they're sharing that information.
You as everybody can tell in the room, I'm working off a script. And I have planned this very carefully. Something that you just said, though, just really impacted me at a deeper level. When you said, what happens when you come in to get a service? You go to a doctor, you go to a policeman, you go to someone that in a situation where you are reaching out for help, and you show up, and I'll speak for myself, and you show up, and sometimes you just know when they're looking at you in a way that they're not going to be able to help you, because for whatever reason, there is a barrier there. Whether just looking at you, they see your condition, or they'll immediately, there's something that they can't get past, and you know it, and then you feel it, and then you may not go back. And I can't imagine what it would be like. I mean, I've had the experience going to doctors or wherever. And you just know. You either connect with somebody or you don't. They either see you as a person, just a person. Get beyond anything what you look like, or the wheelchair or the brace or whatever you use. Just a person. And then listen. And to imagine somebody that has suffered a sexual assault coming in and having someone give you a look like, I don't know how to help someone like you. It would just be devastating. So thank you. Thank you for raising that. That's such an important thing about how we look at each other just as human beings and be able to move on from there without seeing somebody and it's just putting a wall in front of you. People pick up on that very quickly, and it can really impact the services that you have to offer. I wanted,
Could I just add one?
Of
one
course.
One quick thing. We were talking about what are the natures of the experiences of disabled women with respect to violence on campuses. I think that though we also, and this was really raised to me where we were talking about, where one of us was talking about the fact that you have to think about who is the sign language interpreter that you're going to bring in. Is it the sign language interpreter that goes with the student to class? And think carefully about whether you want to violate her privacy in that way. And what that raised for me was that, women with disabilities experience some forms of violence that are a bit more unique to disabled women. Many women experience economic control, of course, but that's particularly important with women with disabilities. Also, the power of someone who may also be giving care or assistance. If someone has a personal assistant with them in campus, but that's the person who's abusing them, sometimes that's not seen as sexual or gender-based violence, but it's seen as bad service provision, and that's not really appropriate either. So I think that we really need to think about what are the unique forms of violence that are experienced by women and men with disabilities in terms of violence on campuses. I also just wanted to add that one thing that I think also contributes to violence is the fact that many young people with disabilities do not receive comprehensive sexuality education that's at all. Students who go to what I will not call special education, I would call it more segregated education, but students who go to those programs, there aren't really requirements that those programs include comprehensive sexuality education. And one of the things that sexuality education teaches you, in addition to how your body works or sometimes doesn't, but also, and about sexual violence prevention and things like that, and pregnancy prevention. But it also teaches one about the power to say no, that it is within your power of what you want to do. And then also, which is very relevant right now as we're all talking about gymnast doctors, but what is appropriate touch and what is appropriate behavior. So I think those are just really important points for us to consider. So I think one of the important things is that the Department of Education really needs to include within its guidance the importance of comprehensive sexuality education for students with disabilities. And at least in my research, I didn't find any information about that at all as a requirement.
I just wanted to piggyback on that and say, I also think it's important to remember that we've been talking a lot about women, but men can be survivors of sexual assault too. And the statistic we have about 1 out of every 3 female undergrads. So that doesn't include students who identify as male or students who identify as trans or intersex. It doesn't include graduate students. And it also doesn't include faculty and staff with disabilities who, remember, most of the time if you're working on a campus in higher education, you had to be a student yourself at some point. So, we're talking about a very diverse population. And I just wanted to quickly say, and then I'll open it up for questions, but there's a handout on all the tables, and I apologize, the Copy Center did not print it They shrunk it down, so it was 18-point font when I ordered it. But that's available to download from the NCCSD Clearinghouse Crisis page. And I'm very sorry to say that the crisis resource page is our most frequented web page at the NCCSD, because we keep a comprehensive list of crisis resources. And unfortunately, it's used by thousands of people every week. So I just put a few of the resources on a handout that's on your table, but you can download that at our website.
Thank you, Wendy. We're doing good on time, and I'm going to keep us on time. I want to address a question to Nitya. Your research for this report identified gaps and weaknesses in equal access to sexual assault programs, education, and post-assault services on campuses. Did you also identify things that were working well in ensuring access to students with disabilities? And can you share some of the things that colleges were doing to successfully include and accommodate students with disabilities?
Sure, and these are detailed in the report. I just want to again highlight that we couldn't have a section on best practices because there is no research on this. So what we're doing is just identifying areas that seem promising or seem to be actually considering students with disabilities. So one of the things that we found, and each college had different things that they shared. One thing we heard was that staff from the disability services were actually trained as advocates on one campus, so that they could be one of the first responders if a student wanted to talk to a sexual assault advocate. So, and we thought that this was something that was so promising. We don't know the extent that training that those disability service providers had on understanding trauma and the needs of sexual assault, but again, there was an intersection between the two sexual assault resources and disability services on their campus. And this college also trained the counselors in the counseling service. So I think one of the staff persons said that they felt comfortable sending their students to the counseling services because they were getting trained on disability awareness and understanding disability from their program, from that college office. Another thing we heard, we mentioned only 3 colleges indicated some content related to students with disabilities in their prevention program or addressing students with disabilities. So one college provided a safe space for students with disabilities to talk about sexual assault in a disability-only space. And this just provides some probably more nuanced discussions of consent and sexual assault in a space for students with disabilities. Another thing we heard was just, again, like having multiple types of communication supports available to students, not just having access to interpreters, but either for CART or UB Duo, just have something in the meantime if they needed to use to communicate with a student that they could access readily. And this was something that that could have access to all campus services, but they realized they needed to make it known to everyone that it was available. And then, one other thing we can highlight is just using the concept of universal design. We heard that a lot of using that concept, and I think Wendy could speak about it a little bit more deeply, but using that concept when trying to design materials so that it would be accessible for everyone.
When you were speaking with colleges and gathering this information and doing your interviews, did anything surprise you? Did anything stand out or jump out at you that you didn't expect?
Yeah, I think which is the title of the report that really stood out to us. We didn't anticipate that we would hear from colleges. This is not something that we've considered. We thought we were going to hear just mainly the challenges of serving students. And one of the things that was really interesting as we would start the interviews, with the participants, there'd always be like a pre-conversation, a chit-chat, and we would talk about the informed consent process, and then we would turn on the recorder and start taking notes. And during that pre-conversation, pre-interview chit-chat, there was a lot of this, yeah, I'm so glad you're doing this. This is not something we're talking about. And my colleague and I realized, oh, this is data, actually. This is not just a pre-conversation chit-chat. This is actually data that this is something that, they're like, and over again, we heard both the transparency of wow, we sent the interview questions ahead of time. I was going, they would say I would go over this with my colleague, and we realized we're not doing anything. And that kind of transparency was really surprising. That people, and like we said, that not only were they transparent, they're like, wow, we need to really start thinking about this, and they wanted to help. They're all there to help students and support them, and again, that this was just not on the radar. So we didn't really anticipate that was going to be a finding, and that was really surprising. And after we recognized that, would start to speed up that informed consent process quicker, so we could start gathering our data and hearing how this was again not on the radar.
Thank you. I want to open it up to questions so we can have a conversation with the audience. So anybody who wants to talk, please raise your hand, and we'll here we go, bringing a microphone over to you.
I'm Liz Weintraub, and I'm a fellow with Senator Casey's office. And my question is, and thank you for this wonderful panel. But my question is, I have heard you talking about disability, but are you talking about developmental? And I think that Sandra came to a order, but I just wanted to double check. Thanks.
This is Wendy. I am most certainly talking about developmental disabilities. For those of you who do not know, there's a huge movement called inclusive higher education to include people with intellectual and developmental disabilities who've been, traditionally excluded from higher education, and including them in transition programming, but also other on-campus programs, job training programs on campus. It's very exciting. If you want to know more, check out my colleagues at Think College, and they know quite a bit about it. In my past life, I was a professor at Syracuse University, and we had a pretty extensive program called Inclusive U. One of the things that we noticed when students were showing up on campus is that they had very little sex ed information that they had brought with them from high school. And they also were realizing that all their college peers were dating and having sex and dealing with sexual assault and harassment and learning, basically empowering themselves. And they wanted to get that same information, but it often was inaccessible, or they weren't sure how to get it. And so that became a very important piece of the work in inclusive higher ed. So yes, absolutely. If you are thinking about students with disabilities, try to keep your mind open to all of what we're saying when we say that word disability. And it definitely includes students with intellectual disabilities who are on your campus. If you call them students, they're students. And you gotta have your services be ready to serve them. So yes, thank you, Liz.
Yeah, I just wanted to jump in with that too, and thank you for bringing that up. Today's talk is focused on college students, but we know that sexual violence often occurs at a much younger age. It doesn't start when people get in college. And often the college population has lower rates of sexual violence than non-college populations. So I would like to expand this conversation as we move forward to look not only at college students, but students of all ages, and how can we start to have a conversation about preventing sexual violence among people with disabilities and any kind of disability or not with disability, starting at a very young age. Certainly you can't start with a young child talking about sexual violence, but you can talk about bullying, you can talk about respect, you can talk about healthy relationships. And I think we really need to do more about that. If we could prevent sexual violence at a younger age, we wouldn't have much sexual violence in adulthood.
I'm Ingrid Jernid with AUCD. So I understand why you, in the preliminary research, limited the scope of what constitute as disability. And if you go on to continue doing research and expand that definition to include people with mental illness or cognitive disabilities, kind of how do you anticipate the recommendations that you're giving on a federal, a college, and also on a congressional level to change?
I could speak to briefly. I think, from my perspective, yeah, definitely we would include that. And I think NCD had a report just recently about students with mental health disabilities and how colleges serve them. So looking at those recommendations there, and what is the intersection of policies around just serving students with mental health disabilities equitably, and looking at how they inform the recommendations around sexual assault. Not sure if there's any particular ones that you had questions on, or. Yeah, one of the things that came up, was definitely the sexual assault can cause mental health disabilities, and as well enhance. I want to say enhance, but exacerbate them. Sorry, that's the term I'm using. So that's something that came about, and how both the accommodation process and the Title IX accommodation. So there's those set of accommodations, how they need to be really working together to support the safety of the students. So I could see some more detailed recommendations around the intersection of those accommodations provided to students.
And I think another thing that's very important as you're considering that is, which this brings to the forefront, is these forms of violence not only can exacerbate existing disabilities, but they can actually create new ones where there were no disabilities at all, or additional ones amongst people who already have some other disabilities. And one of those examples that relates to your question is around post-traumatic stress, and how are college campuses equipped to support students, not only with the immediate aftermath of these forms of sexual violence, but the longer term post-traumatic stress that can result, and just ignoring that, and what are the consequences of that on the student and the student's ability to continue effectively in their college work.
Yeah, I just wanted to kind of tack onto that as well. One of the recommendations I provided was around, asking if people need accommodations, people who are seeking your services, and I believe it was Wendy that touched on, and I think this is, we see this a lot, is the case for people who have mental health disabilities, that they may not identify as a person with a disability, they may not be familiar with the language of accommodations, and so it's just, it's very important when you're thinking about how to ask that question, if you need an accommodation, asking it in a few different ways, so that someone who very well could benefit from some sort of accommodation, while receiving your services, moving through the student conduct process, again, may not know to ask, or even if you're asking them, if you're using particular language, they may not be familiar with that language. So just another thing to be thinking about.
My name is MJ Solomon. I'm with the National Council on Disability. I know that you all said that this issue is not even on the radar in places where it should be. But having said that, it seems to me that these issues aren't going to be tended to unless a large population of people pay attention to them, be it with respect to disabled people or the larger population. And looking around this room, I'm seeing that there's probably only 10 or 11 of us men who came. Maybe that's a coincidence, but probably not. So I'm wondering if anybody on the panel can speak a little bit more about any data or trends you've seen with respect to increasing awareness in these issues among men, and any efforts to that effect that you may have seen. It just seems to me that this is the type of issue that won't be solved unless, you know, men care about it too.
Well, we didn't really focus on the gender of who is paying attention. I know that recently in the press we've heard a lot of women, and from recent press stories and the response of women that has been, please men step up, please pay attention too. But beyond that, I'm not sure.
Well, I think that's an excellent question, and thank you for being one of the 11 men in the room, and thank all the rest of you as well. I can't answer that question in terms of the intersection between disability and violence, but I will tell you that in terms of the prevention of sexual violence, frankly, we need more programs that can demonstrate effectiveness in terms of preventing sexual violence. Some programs that have been starting to show effectiveness definitely include men. There is a program called Coaching Boys to Men, which has shown effectiveness in not only changing male attitudes related to sexual violence, but also actually decreasing sexual violence perpetration. There's some other promising interventions about bystander interventions, where we train people to recognize risky situations. So if they see a risky situation that someone else is in, for example, they've been drinking heavily at a bar and somebody's approaching them and it looks like it could be a recipe for disaster, how to intervene on that. So we are in the beginning stages in terms of violence prevention, sexual violence prevention, including men in that process. But also we do have programs for women in terms of trying to reduce potentially risky behavior, identifying potential red flags. So we haven't done enough. We have a long way to go. I'd like to see us grow that area. And just in general, when we talk about interventions here, I'd like to also ask us to always think about, let's see if they work. Because many times we put things in place, not just about violence, but other types of interventions, really well-intentioned, have not evaluated them well, and then find out that they're really not effective. So these two things need to go hand in hand, the interventions and evaluation of their effectiveness.
Yeah, and that's a really important point, because a lot of the programs on the global scale that, you know, disability independent, that have attempted to, you know, do more work on engaging men haven't been evaluated in terms of, you know, are they really effective? The ones that I have seen that have been evaluated and show effectiveness are the programs that really focus on boys. You know, in other words, by the time a guy is 35, it's a little harder to turn his head around, but or even 25 maybe when he's in college or grad school. But you know, if you work on boys in middle school, elementary school, high school, in terms of, you know, just appropriate behavior and respect and consent, those are the ones that seem to be more effective when actually evaluated.
We have time for another question, if there is one.
Thank you. I'm Ruth Townsend from George Mason. Mine's a follow-up to both the intellectual disability and the sort of cognitive mental disabilities, in that on one, particularly in going through either counseling or going through a student conduct process, I think it's not only important to figure out how you're asking the questions, but what someone is telling you might lead you to think, okay, or to think, okay, we need some additional assistance here. I mean, I think we all offer that someone can have someone with them through that process, but asking, okay, do you want an advocate with you? Would you like a counselor with you? We have a lot of students on the Asperger's spectrum who are going to have trouble telling their story. in a way that they'll be believed, because the story changes each time they tell it. We've been there. So that listening to what they're telling you, because they may not say, oh, I don't need an accommodation, but I need this, and what they're asking for. The other is the intellectual disability. We have one of the oldest programs, our life program, and internal to the program, they do their own training, because dropping students who are in a special program, post-secondary program for students who are not really eligible to participate in the college process, in many cases looking at 4th grade, 5th grade reading and comprehension into your existing training programs is probably not going to be very effective. Plus, there's a repetition element, and we've been there too, and also have had to modify all of our processes so that our students it's in their contract, they are subject to University Code of Conduct. So they go through a code of conduct, but we have now put some elements in place to assist, and we did this on the fly, and then took that step back to evaluate, and we're still evaluating. And this was internal, a young woman in the program filing a complaint against a young man in the program, and it was sexual touching. Happily, not anything violent. So that gave us the opportunity to really work through this. But you're going to need to be looking, if you have those programs, you have students on your campus with intellectual disabilities, you really do need to look at how they're going to intersect with your processes, because you can't just dump them into your process. And we also had to educate the police a little bit on a different one where it was an external person on sexual touching.
I thank you for raising that. And I just wanted to say that we have been, Vera has been working on working with some communities that are funded through the Disability Grant Program. So it's not necessarily campus or isn't campus specific, but we've been developing and piloting a curriculum for self-advocates to train other self-advocates on domestic and sexual violence. So it is designed for people with intellectual disabilities. So I just wanted to say that's a resource. I don't know if we've actually officially made it available. I think we're still moving through the piloting process or potentially the approval process from our funder, but just wanted to say that that's something that we've been working on. A colleague of mine has been doing that work. And I also just really wanted to quickly add, again, this is not campus specific, but we have we created a website. It's www.endabusepwd, as in people with disabilities, that specifically focuses on domestic and sexual violence of people with disabilities, kind of how, different responses, promising practices within that. There's also a whole section on there about making sure that any information you're providing is accessible, kind of things to look for, things to check, and accessible and inclusive of people with disabilities, and also designing in-person events that are accessible. So there's a lot of resources on there that touch upon, that would support some of the recommendations that have been made. Again, it's not campus specific, but there's quite a lot of parallel information that could be very easily kind of slid into the campus environment.
All right, thank you. I want to say that we did not provide in this presentation today every recommendation we made in the report. Please look in the report. It really is very intriguing, and I think there are a number of recommendations that are very, very important. I want to just close by asking you to share the information you heard today broadly and further the conversation with your colleagues. Implementing the recommendations in this report is going to help ensure that all students have access to critical information and services around sexual assault, and that federal laws and research on campus sexual assault will be inclusive of persons with disabilities. Again, I want to sincerely thank everybody that came today and for your interest in this topic and making your way here on this cold winter's day. And I want you to know the report is online right now on the NCD website. And please feel free to come forward and meet anybody on the panel. We'll be here for a few more minutes. But thank you again.